Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, this is Tom Viola with yet another Fast Facts Pharmacology Edition. Well, we've talked about peptic ulcer disease, PUD, gastroesophageal reflux disease, GERD. Now let's talk about how to treat them. Well, we've focused on both disease states and we've said what? Both involve lifestyle changes, changes in diet, difficult things. But what about drug therapy, pharmacotherapy? Well, there's a few drugs we can use to treat both peptic ulcer disease and gastroesophageal reflux disease. But they both involve limiting stomach acid production. The first type are called histamine 2 receptor antagonists. They block a specific receptor called histamine 2 receptors in the stomach wall, in the parietal cell in the stomach wall. And by blocking those receptors, they block the production of protons, which, as you know, in our physiology, protons are acid, right? That's why we measure acid in pH. What does the H stand for? Hydrogen ions, also known as protons. Okay, so what are these H2 or histamine 2 receptor antagonists? Some names you might find familiar: Tagamet, cimetidine; Pepcid, famotidine; Zantac, ranitidine. Okay, so you've seen these drugs, you've heard of them, and you are also painfully aware they are available over the counter. And that means patients can buy them and take them pretty much at will. Even though the package says don't take for more than 14 days, many people do. But why? And the question is, they've seen a lot of commercials on TV where the guy gets beaten up by his taco, and they know what? I like tacos, but tacos don't like me. No worries. I'll take a Tagamet, Pepcid, Zantac, and I can eat all the tacos I want. So these medications go from being, treatments for peptic ulcer disease and GERD to actually, for some folks anyway, alternatives to, their better diet, basically a substitute for better eating habits. Okay, we know they're supposed to be used short term for both peptic ulcer disease, GERD. Sometimes they use longer for chronic conditions like Zollinger-Ellison syndrome, which is hypersecretory disease, too much stomach acid production. But ultimately, these H2 antagonists are widely used, but they do have their side effects. Things like headache, nausea, diarrhea, constipation. That's a trifecta. And remember, you need stomach acid to digest your food. So it kind of makes sense that you have those side effects. But wait a minute. Isn't there something even more far-reaching than that? Absolutely. If you can't digest your food will sit in your stomach until it is digested. That could be hours when you've shut off stomach acid production. And now that food is sitting down there in your stomach at a balmy 98.6 for hours. And you might sit down next to somebody on the bus and open your mouth to say something, and that person's going to look at you and say, wow, your breath is kicking. You bet it, my friend, it's halitosis. Anything else? Well, if I had bad breath, if the guy on the bus next to me said, man, your breath is kicking, where do you think I'd go to complain about that? I'd come see you. And that means what? Well, you're going to have to be the one to tell them, hey, it's not this, it's this. What else? Well, remember that these drugs are famous for causing drug interactions, but they're available over the counter, and patients might use them indiscriminately. So we want to make sure that when we see the telltale signs of peptic ulcer disease or GERD in our patients, and they're telling us they're taking these medications, that we're making sure that they're taking them appropriately so that they're not increasing their risk of other adverse effects. Like what? Well, don't forget, you need stomach acid to absorb calcium. And on our next Fast Facts Pharmacology Edition, we're going to talk all about what effect that has on dental implants. Until then, my friends, this is Tom Viola. Looking forward to seeing you soon live, but in the meantime, stay well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care. creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.